So, doping in cricket, I will only discuss the important issues, and then when we have a discussion, the questions are welcome. So, I will highlight what are the WADA issues and what are the ICC that are trying to put this in our frame. So the most important concern is to protect the sport of cricket from doping. Why? Because the cricket is increasing, the money is increasing, and when these things increases, then the problems also come with this. There is nothing that it can come now. And to also ensure that the cricket remains clean and there is a fair play, so that we want to give equal opportunities to each and every cricketer, so that the concerns are being taken care of. Now, the considerations: the ICC anti-doping code is compliant with the WADA code, and it ensures that the cricket player plays its part in the global fight against drugs in sport. And the most important mantra that is being followed is stay informed and play true. So our as a mentor, as a coach, as a physician, as a sports support staff, the most important is to be we have to get in we have to be stay informed and make this knowledge or the education aware to the athletes in place. So use of doping in the game of cricket is very rare compared to the other sports, where for example in athletics, in weightlifting, in boxing, these are the sports which where the doping is very prevalent, and their federations has taken steps in order to check that. Now just coming to giving you an insight on the historical perspective, the concerns for health and the fair play is the most important thing which drove the WADA for the development of anti-doping rules. In 1928, see, 1928, we are now 100 years. IAF, the International Athletic Association Federation, is the first modern federation to ban substances. It was athletics that banned the things. In 1967, the IOC Medical Commission, they developed a prohibited list. In 1999, so only we are again 25 years, the WADA was created, and 2004 the WADA publishes the prohibited list, and each year in January now the WADA publishes the list of the drugs which are banned across sports, in competition, out of competition, accordingly. And there is a global DRO website which you can see which drug is banned and which is not, in competition, out of competition, all these things. Now the most important thing that this is a take home message for everyone, is that all the support staff and the athletes who are working, they should know and understand the principle of strict liability in doping. This states that each athlete is strictly liable for the substances found in his or her body specimen, whether or not the athlete intentionally or unintentionally used that prohibited substances. So this is the strict liability principle. If something is found, you are liable, even if you have no intent or intent, that is another issue. Now this principle has been entrenched in anti-doping for decades and has been upheld in the court of arbitration, because once our athlete comes dope positive, then he or she fights with the NADA, then he may take you to the federation, to the arbitration of sports, in order to say that he is fair and he has not taken any substances, or his support staff unknowingly gave him what not, they will say. And there are provisions in the code where the athlete may receive a reduced sanction if no significant fault is demonstrated by, importantly, the burden of proof is on the athlete. So this is a caveat that the WADA has given to the athletes in the strict liability forum, so that the if athlete is not at fault, then they may reduce his punishment or his sanctions. So ICC has been drug testing this event since 2002, and the ICC became a signatory of the WADA in July 2006. And this ICC anti-doping code applies to all times to all players, men and women, who participate or have participated in the last 24 months in an international match and or domestic match. So this is the regulation now that the ICC is following. And the ICC anti-doping wing, which functions to maintain the integrity of the sport of cricket, to protect the health and rights of all participants in the sport of cricket, and to keep the sport of cricket free from doping. This is the basic structure that they are being following, but we don't have so much of doping menace. But there is one important thing that we will be discussing later on, is this is the advice card which each and every coach as well as athlete should be informed about, which highlights the strict liability principle, the list, the supplements. When nutrition increases, the supplements increases, and these supplements may be contaminated with some drugs on the process, some hormones, anabolic steroids and all, which are being sold in the market with no regulations, and the prescription medicine and the therapeutic use medicine. But what we have found, that there was some cases for the cough and the cough syrup that is being provided by a hotel in Indian cricketer who was banned due to that. So these are the therapeutic use exemptions. The support staff should know, and the athlete should also know what to take, what to not. He or she should ask questions to his support staff, because always the doctor is not with them, that if this drug or this that is being monitored or not, or in the prohibited list or not. Most importantly, the cough lozenges or cough syrups and all, which may be some banned substances may be there. And the natural does not equal safe. That is also, it is an important thing to understand. And also substance for abuse, because with money comes the problem, with success comes the problem. So they may use substance abuse. They are outside their from their family for long days, for the long months. So they may be using some substance abuse and all these things, or some habits may be there. So that needs also to be checked. You have to be a strict disciplinary in order to maintain at that level, at an elite level. So the just to give you a highlight on the doping control, the ICC conducts the doping control, and international testing agencies, or the NADO, or the National Anti-Doping Agency of that country does it, independent agency. The doping control is the process of testing cricketers for the use of prohibited substances or methods by collecting urine or blood samples, and then it will be processed in the WADA accredited laboratory, and then the reports will become. The selection of cricketers may be random, or maybe there may be a targeted testing. Most importantly, the targeted testing is for athletics, for hockey, for all these, boxing, then weightlifting. These are the things where these targeted testings are also organized. Now this is an important issue, because your athlete may have some problem. For example, he is out to a country, in another country, and there may be some gastrointestinal issues, maybe some cough issues. The cough syrups are a problem again. So at that point of time, it is the player may need a prohibited substances or a method to treat him a legitimate medical condition. At that point of time, TU is important in order to prevent that athlete from any problems. Maybe he may be selected in the next match, a random selection for this doping control, and that may be a problem at that point of time. So it is a good thing that the TU applications, which may be sent to the national anti-doping associations, to be on a safer side if some problem comes. And this process has to be commenced 30 days prior to the game or the event. So but there are also provision for a retroactive TUEs are also possible, where if suddenly an emergency situation has come, the physician can give the drug, and then they can apply for the retroactive TUE, so that the athletes is on the safer side when if a doping control has been done for that. So this is the whole this is being published by the ICC. So this is the way, and each and every coach, as well, because because always the athlete, that the team should may not have a physician, and the coach is the first point of contact, and then his physiotherapist is the second point of contact. So at that point of time, it is important for all the support staff to know and understand the substances that they are giving. And also it is the responsibility of the athletes also to understand now. Otherwise, most importantly, the elite athlete. But if we create strict discipline, we make the athletes informed from a young age, then I think that it gives a good control, that we have seen in football, that we have seen in athletics. So all each and every time the anti-doping education seminars and all these are going on, so that to help them and to take this forward, so that the doping menace is less. So this is one which we must understand, that athlete and physician needs to understand that, and if any prohibited drug or any drug which is a legitimate use for the athlete is being done, so we may apply for this TUE, because TUE is very less TUEs are being used across the world. Now again, we have an Adams website. This is also a brief information for you all, that central databases are there, secure communication and automated calculation and updates are also there. So the anti-doping organizations share mechanisms, and one athlete, one passport. That is all also they are making now the biological passports, in order to understand that when the drug is there in the body or not. So all these things they are trying to improve it. in the body. Rapid evaluation and targeting allows WADA monitoring and criteria for the global efficacy of the athlete biological passport. This is the new things that we are coming. Each and every athlete will have now the biological passport in order to monitor his drug, or he is taking any substance for that. So again, the mantra is to stay informed. Education plays a lot of role. Your first contact should be your national anti-doping agency, or the organization. They have specific information about the specific pharmaceutical formulations in your region of the world. So they may also have advisories of supplements which are particularly problematic. Supplements use is we have found in across many Olympic sports that the supplements may be a problem. So when you are using supplement, it is very important to have a batch testing and all these things in order to be sure that the supplement is not been contaminated with any anabolic steroids or any hormones or like that. Now again, the current list of prohibited substances and methods are there in the WADA website, and everybody knows this. And these are the very important thing, dangers of doping, which we may need. These are the cards that are there, which is important to share with your athletes or your cricketers, so that they also are aware of what the dangers of doping are. Because when you know the danger, then you can have a proper implementation of your program. And the most importantly, athletes, the drugs that they use steroids, they use stimulants, they use EPO in marathons, and all these things. They use masking agents, they use growth hormones, and again, you can see the marijuana and narcotics are also. Marijuana is again abused by the athletes as a substance abuse, and to have fun or the kick and like this thing. And also the narcotics may be used. And so these are the things, these are the basic and the important fundamental things that we must make the athlete aware of. And I think that if you are staying informed, if you use your little bit of common sense, then there will be not any problem anytime with any athlete or with any of your things. So with this, I would like to end with the last, that they have Athletes Anti-Doping Rights Act is also there. So if you are you can, if you are if you have been sanctioned by your NADO about any rule violation, then you can see your rights, and based on that you can apply. You have the right to appeal, or you have the right to go to the important forums and then put your case in order to have a fair justice system in place. So with this, I end my talk, and then the goal is always to rights of the athletes to doping free sport.